subsidy from the national government?
Yes. Short answer, Mr. Chair, Kong Jude. Yes, may sapat na pondo. If I can just mention lang, alam niyo po kasi we're doing a reorganization. We want to increase by 30%. Malaking kumpanya po yung PhilHealth, 10,000 is a huge number. So we were hoping lang sana yung admin cost po namin, sana pwedeng ma-review and kung pwede sana ma-increase sana to 7.5%.
Well, I think naman personally, Mr. Chair, Press Mandy, I think everybody naman is in agreement that we cannot, this situation that we're doing is a remedial one. It's not really naman to really defund PhilHealth, at least with its subsidy, no? But we're also hoping, as I mentioned, the frustration is shared by everyone. We're also hoping, we're also looking forward that if you make, Mr. Chair, the necessary corrections, including holding accountable, because accountability, Mr. Chair, is very important in this respect, especially kasi nakikita natin, nobody goes to the hospital. Ang totoo niyan, Mr. Chair, yung nagkakasakit, wala pa akong kilalang nagkasakit na sakto yung budget niya. Palaging nakukulangan yan, palaging kulang yan. Kahit mataas ang katayuan sa buhay, pagka nagkasakit talagang you're placed in a crisis na your options are limited. So I hope we take that role seriously, more than just being an insurance provider. No, it's really the nature of health as a right of every Filipino. Ito lang, kukulitin ko lang kayo, susundin ko lang yung sinabi ni Kong Stella. If there is a proposal to reduce contributions, it is something that PhilHealth is now, given the reality, willing to consider.
Yes, Your Honor.
Do you have a suggested ratio in mind or percentage in mind?
Actually, Your Honor, like I mentioned earlier, the Senate bill has already been passed, no, to reduce the premium contributions from 5 to 3.25. We fully support that po. So maybe that might be a good start, no? Actually po, malaki na po yan. That's 1.75%. So we will fully support that po.
And that will not affect adversely the expansion initiatives we have in terms of the case rates, and be able to do it progressively still moving forward.
Actually, Mr. Chair, Kong Jude, we have learned in PhilHealth to go with the flows, no? To go with the flows, to go with the, I don't know if punches is the right word. We always play the best hand with the cards we are dealt with. So to answer your question, sir, of course, it's a huge reduction, no? We will do our best, sir. We like I said, whatever cards are dealt to us, sir, we will play it to the best of our ability.
Press Mandy, everybody is doing their best. Of course, you cannot, I believe the committee deserves a much indicative answer than just do our best, di ba? I know you cannot draw the numbers off your sleeve right now, but I hope you can submit to the committee a clear calculation, di ba? Kasi
No.
next time, pag nag-budget hearing, then you ask for your subsidy, we'll also tell you, we'll do our best.
Mr. Chair,
and
yes.
in the end, the people cannot be given those responses. Let's work together.
Yes.
Kasi mahirap yun eh. Right now, I think the message is clear. The subsidy has been withheld so that you can, look into improving efficiency and also providing greater transparency in terms of your research and surplus funds. And I don't think that's going to be a situation na forever ganon. But I hope that also, leads to greater accountability on both sides and making sure that we are able to do well with our respective commitments, especially with regards to the universal healthcare.
Actually, Mr. Chair, yes, Mr. Chair Kong Jude, we will study put it together, and we'll submit to this committee, no, the findings of our study. We'll study it thoroughly. Prior to the study, I personally feel that kakayanin pa rin po, no? But you're correct in saying, of course, we'll put together the figures, the numbers, and we will submit to this committee. Also, Mr. Chair, Kong Jude, if I may add, no, the president, actually, President Marcos, when I saw him last week, no, he's actually requested me to submit to him before the year ends a detailed breakdown of the status of the digitalization of PhilHealth, number one. Number two, a breakdown of all of the benefit packages that were increased, and then the date of approval, date of implementation, so and so. And lastly, the complete status of the payments of claims to all the private and public hospitals. So we have put that together. I'm working on it. In fact, I think it's expected to be completed in maybe around 48 hours. So I really intended to, I told the team, no? Well, we will submit it to the president, but at the same time, we will submit it to this honorable body. We will also submit it to Executive Secretary and to the PSAC Health Committee. So that will show, hopefully, Mr. Chair, Kong Jude, that will show what we have done in the last 2 years. And we will include there, for example, yung sa benefit plan po, we already have a 3-year benefit plan. So we will include there what has already been done and what we intend to do for the next 2 years. No? So nandun po nakalatag, naka-detail yan, naka-breakdown lahat yon, including the digitalization po, lahat na successfully na bid out namin, and lahat na we are planning to bid out in the next year or two, diba? So everything, I think there, it will be safe to show that meron naman po kaming ginagawa po sa PhilHealth. Thank you very much, Your Honors.
Thank you, Press. Mr. Chair, one last point, and siguro you can also put also the reorganization prospects for PhilHealth. Kasi that would, remember when you increase the case rate, that would also mean more things to do and more money to spend, and that would necessarily come with also adjustments in the organization, and that would be justifiable, and also we would know how to make you accountable for that.
Yes, Mr. Chair, Kong Jude, Your Honors. Duly noted, sirs.
Mr. Chair, it is clear from the discussion and the responses that systemic inefficiencies, failure to adjust case rates in a timely manner, and an evident breakdown in leadership over the past several years have severely impacted PhilHealth's ability to fulfill its mandate. Clearly, this has left patients and healthcare providers to bear the brunt of these shortcomings. And I agree, and I will hold President Ledesma accountable with his commitment to adopt structural reforms, ensure leadership stability, and implement regular and responsive case rate adjustments moving forward. I hope we can make good on our policy of reviewing case rates, if not every 3 years, if we can do even less than that. I believe, Mr. Chair, the Filipino people deserve a health insurance system that works efficiently, transparently, and reliably. Thank you very much.
Thank you, Congressman Jude Asidre. Before I recognize the
Mr. Chair.
Honorable Ramon Gutierrez, just one question to Mr. Ledesma. Mr. Ledesma, I understand that you've been the President and CEO of PhilHealth for the past 2 years. Tama po ba?
Yes, Mr. Chair. To be exact, Mr. Chair, November 23, 2022 was my first day.
Okay, so more than 2 years already.
Yes, Mr. Chair.
Okay. My question is, despite of this hindi naman natin masasabing lack of budget because you have your